No? Okay, well, you're going to find out. See? Told you, Brett. All right, what that basically means, anyone here ever gone to a hospital or emergency care and had to fill out a whole bunch of forms, et cetera, et cetera? Well, imagine if it were appified and you were able to go in and get just the services you need, hassle-free, and have all your records distributed and delivered to the exact place you need it all at once, right? More or less. That would be kind of kick-ass, wouldn't it? That's what Brett's going to talk about. So he's a successful entrepreneur. He's built and sold multiple companies. He's smart. He's funny. So why don't we give a big round of applause to Brett Blackstone. He's going to talk to you about it. Take it away, man. Here's your clicker.
All right, thank you. Thank you very much. Again, my name is Brett Blackman, CEO and co-founder of a company
Blackman. Sorry about that.
You're good, bub. I'll take whatever. Right? All right, so CEO and co-founder of a company called Health Splash. So I'm going to start with a story. Then I'll tell you kind of why we're doing it, what we're doing, and how we're doing it. So in 2008, there was a group of dads. They were doing a study with their sons, kind of a way to transform from boys to men. It was called Raising a Modern Day Knight. And these dads decided that they wanted to take a trip to Mount Ida in Colorado. It's a 14,000-foot mountain. And they wanted to take this trip and hike with their boys. And so it's a 14-mile hike in one day. And you have to get to the top of the mountain by 2 p.m. It's a very difficult trek. So anyway, several weeks before they go on this trip, they decide to start working out. So they all work out. Good time for their dads and the sons to really bond and become men together, right? And so they start working out. They go on this trip. And one of the dads had 3 sons. He was the only one there with 3 sons. And on their way up the mountain, there was one of the dads with 3 sons, he started getting a headache, getting sick. He starts sucking on those oxygen tank bottles. If you start when you get up into high altitudes, you get some altitude sickness maybe. Starts vomiting. The sons are just razzing him. Like, oh my goodness, man, old man, you should have been working out with us a little bit more. We had this 70-year-old woman walking and just running right on past the whole group. And we're like, dude, Dad, you got to get on up the mountain. Carrying his backpack up the top of the mountain. We finally make it up to the top of this mountain. And we get to the top, and it was amazing. The dad sat down each son and told them what they were most proud about. Absolutely incredible time. They all go home, and a week later, one of the dads called his oldest son. And he says, Brett, that headache wasn't altitude sickness, I have brain tumor. He says, you need to come home. I was the oldest son. I was 24 at the time. My dad was 47. Immediately went home, sat down, my 2 brothers, 13 and 15, and we discussed what we were going to do with this new, what we called adventure. Our family motto is making memories, good, bad, the ugly ones, and everything. Immediately, I was pretty successful at the time, had a few hundred, almost 1,000 employees. I took 100 people in my company, and I devoted them strictly to research because I hate to freaking lose. And this wasn't a loss that I was willing to take. It was life and death for my dad. So I took 100 people, and we started doing research worldwide on what is the best solution for what this one was, which was a glioblastoma on the brainstem. Survival rate's 5%. But what they don't tell you when you're at MD Anderson Center is 5% means you live longer than a year. 100% are dead in 3. At that point in time, I realized how broken the healthcare system was. I was in digital tech, healthcare, EHR systems, all that stuff that runs all of our hospitals. That's what I was involved in. And I realized I had to do something, because what I realized at that moment was that our society is so screwed up when it comes to managing data in the healthcare space. They continue to do it in all of these silos, and as a society, we're not working together. There are incurable diseases that are now being cured. 2 years ago, hepatitis was incurable, and now it is. 6 weeks, cured. But only one silo fixed that solution because we're not working together as an entire society. So my why on why I wanted to build what we're building is I wanted to be able to take and collect that information, that data, work together, and actually start finding cures of things that right now are incurable. It can absolutely be done. So I go to one of my friends of 10 years, a very, very successful businessman in Kansas City, is where I'm from. And I go to him, and he's one of the most brilliant engineers I've ever met. Owns a very successful technology firm. And I said, hey, I need you to help me build this. This is what my idea is. And he goes, you know what? My CTO, I was sharing him with my CTO, and he goes, Brett, my why's a little different. And he goes, my wife, who currently, she has, not my wife, but my CTO's, stage 4 breast cancer. And 6 years ago, when they found it, they found some cancer in one of her bones in her leg. And the doctor came in and said, we can go in and biopsy it, or I can just go in and remove it. Either way, I'm going to have to probably remove it if I biopsy it and find out that it is a cancer cell. So they opted to actually remove a portion of her leg. The surgery actually went really, really well. Got all of it. 6 years later, just last summer, they're working in the community garden with her son, her daughter, and his wife. And immediately she collapsed in screaming, agonizing pain. Jeff ran over, grabbed her by the arms, knew exactly what happened. Like, he immediately knew. He said, call 911. Calls 911. The ambulance comes out. They rush her to KU Med Center, which is one of the top surgical centers in Kansas City, because that's where the physician was practicing at the time, at that moment. They had done the surgery previously. And they get in, and they take an x-ray of the system, and literally, they're sitting there, and they're like, we can't even tell what the leg looked like before it got twisted and mangled and destroyed. So she's in agonizing pain. And we got to get the medical records from Menorah, which is a different hospital silo down the street, on a different system. And it's going to take 2 to 3 days to get that. And he's sitting there thinking in his head, my wife is in agonizing pain in a hospital bed, and it's going to take 3 days to get a picture. He goes, I have a picture on my cell phone. Will this work? That's the one I was just showing. And they immediately took him back into the consultation room with all these doctors, and they're looking at his cell phone, blowing it up on the screen to figure out if they could actually rebuild her leg with a new one. And they successfully were able to. And he goes, my why isn't the data, my why is the medical records. I want to make sure my family, my medical records are with me at the time I need them, to make sure they go to the right person at the right time so that I can at least eliminate my family's pain, suffering. So his why was making sure he controlled his own information. HealthSplash's why is to deliver the right data to the right person at the right time to save lives. And according to the CDC, just in the United States alone, over 900,000 people a year die from preventable diseases from not doing that. That's just in the United States, millions worldwide. My why was for my dad to see my son for the first time before he passed away. Jeff's why was to make sure that he managed his own family's care, because did he really want his wife going through that kind of pain? Maybe your why's transparency of the data system. I mean, people are like, Brett, you get pretty intense. And I'm like, I don't know of a good yeehaw solution in healthcare. Yay, I'm saved. By the way, here's your bill. You might go bankrupt, or by the way, sorry, we didn't save him. By the way, here's your bill. I don't even know what it cost. Millions? We don't know. It's like going to the grocery store, getting all your groceries and getting a bill a month later and having no idea what that's going to be. But it could bankrupt you if you're not careful. I know in transparency, plan of care is important. I won't go to and buy a TV without looking at reviews on Amazon. But yet, I'm supposed to go to a doctor who's supposed to save my life, and I have no idea other than maybe some other doctor referred him to me. Maybe it was a country club buddy. I don't know. My payer said to go there. I have no idea. To give you an example of this, my grandmother, after losing her son, and then a few months later lost her mother, had a heart arrhythmia. And so they put her on some medication. And our family thought that she just lost her joy. I mean, I couldn't imagine losing a son. I couldn't imagine losing my mother right afterwards. I mean, within months. And for 8 years, she was on this medication with this heart arrhythmia. We just found out in the last 7 months that the illness, the lack of strength, just the lack of joy, the depression, had nothing to actually do with what happened to her 8 years ago. 9 years ago now, when she lost her son. It had everything to do with the medication she was on. And the reason she was on that medication, that doctor, that was the only one he knew for that particular situation. Till she went to a different specialist and saw a different solution. And now she's fine. She lost 8 years of quality life during her 70s and now into her 80s that she can't get back. Because the plan of care was only what that doctor knew. Not what society knew, but what that doctor knew. It's not the doctor's fault. It's too much information. My family, just lots of tragedy, right? My family, myself, men in my family died before the age of 60, most of us, and mainly of heart disease. And so I am building a solution on our platform specific to me, which is to manage and monitor biometric data. There is actually proven data technology solutions that can take biometric data, your wearables, combine it with your medical history, your genetic testing, and can actually predict if you're going to have a heart attack up to 2 months in advance. Did anybody know that? It's there, waiting to be used, and no one's using it. That's one of the projects I'm personally working on. So our question is, if healthcare is broken, it is absolutely time to own your cure. And that's exactly what we do. So our company's not a theory. We're not a white paper. We're actually a real company. 40 employees, hundreds of thousands of dollars a month in cash flow. We actually started building our smart workflow and road infrastructures for interoperability with all of your systems, all your network systems. Consider it like interstate highways from one city to another. But we're going to give back. We're giving the tools back for the community to start building county roads, city roads, and even driveways into the doctor's offices, because there's no way for one company to own everything. No way. Community smart workflow contracts are what we consider standard operating procedures across all healthcare, because I don't care where you're at in the world, the same procedure will work. We're all humans. We all have the exact same biometrics to an extent. Everybody's a little different. But there's no standard procedures anywhere. Everybody does it a little differently. Yet there's no one to know actually if that procedure is right or wrong. There's no consensus. There's no validation. There's no reviews. There's 1,000 reviews. I spend hundreds of thousands of dollars trying to solve that problem for my dad. None of it exists. And then you can turn around and take, once you've redone the infrastructure of the healthcare system, of the data system, you're going to be able to move from what we call reactive care, which is what we live in today, to a proactive healthcare system, which we should live in and will live in tomorrow. So right now, we realized, and I've spoke at several events, government events, large data center events, and the major issue in healthcare is everybody is in silos. Medicare, Medicaid, United Healthcare, London, Europe. Yeah, they're great. national healthcare systems, still data silos. Travel. I don't know how many of you guys traveled internationally, but I'm guessing if you get sick here or something happens to you, your data is not with you. Nothing communicates. I was talking to the chief of staff of United Healthcare, and I was going, this last summer, and I was talking to her and I said, this is absolutely what we're building. Is it something you guys would get involved in? And then she goes, we've actually tried to build this before, but no one will build on someone else's platform. The government won't build on United Healthcare's platform. Medicaid won't. Humana won't. Medicare came out. The government came out and said, let's make one big platform everybody builds on. United's like, yeah, no, we're not giving you our patient data. Not happening. So all of a sudden, you have all of this data not transferring. Kudos to Apple. Apple will now be the largest silo of data with Epic, Cerner, and several other groups that are coming on to create what? Another big silo. Are they solving the problem? No, they're making it bigger. The only way to solve healthcare is through a distributed, autonomous organization. And for the first time, blockchain is going to allow us to do that. So the question is, who owns a DAO? Everyone. They all do. I've given this exact same presentation to multiple government agencies. We're working with a bunch of them all over. They all need to integrate, but they all want to own their own information. And at the end of the day, you know whose information people want to own the most? Your own. Who governs it? Everyone. Who integrates with it? I'm going to guess you can probably guess this. Everyone. With interoperability, a DAO, when one node is updated, all nodes are updated. Remember, a token is nothing but a line of code. Yes, tokens are great for currency, but they're actually better for interoperability. Give you an example. Our COO actually met with Medicare and a company called, I can't actually probably say their name, one of the largest medical supply companies in the country, specifically about diabetic testing supplies. Okay? This is how our system works. It's the most messed up system in the United States. Let me first off tell you this. $10 trillion a year is spent in healthcare worldwide. $3 trillion in the US, with $1 trillion in administrative waste and fraud. 10% of the worldwide GDP in healthcare is spent in the United States on administrative waste, regulations, and fraud. $1 trillion a year. You know what that could do if you could fix that and actually use that money to, for proactive care, curing diseases? So anyway, Medicare comes out and they said, we're going to create a new standard operating procedure on diabetic testing supplies that all the doctors are going to use all over the country. We're going to spend a $100,000 budget to build the program and then $25 million to educate the system for one billing code. Basically saying, are you alive? Because they're not going to deny diabetic testing supplies to their patients. They just want to know, are you alive? Try to eliminate some fraud. And the way that actually works is they educate, and then only about 70% of the doctors actually make changes in their procedures inside their practice to actually put that implementation in place. So then what does Medicare do and these other agencies? They actually start auditing and actually taking money back, forcing the industry to make that change. It's really, really efficient. With a DAO, nodes, and interoperability, the moment a regulation changes, it can absolutely be integrated directly into a workflow. So if you have a diabetic testing workflow, and if we can get this put up on the screen, this actually makes, so you understand how this works. The moment consensus happens on a new workflow, the community can develop it, and it's instantly integrated into the system, into the workflow. Because do you think a freaking doctor cares if he has to ask one more question? No. He's there to take care of his patient. He doesn't care about the crap that the regulators are trying to do. He is there to take care of you. Just tell him what he needs to do. Don't even tell him, just have him fill it out. Maybe the data could actually be smart data, and you could quit filling out the same damn forms 55 times. Because I'm telling you what, my birthday hasn't changed. Born on the same day every time. But let's turn this data into smart data. Once you do that, we actually have solved the next step, which the community doesn't realize is an issue. They talk about it, but it's called KYC AML. Know your customer and anti-money laundering. And through our system, because of what we're doing with healthcare, we absolutely know who you are. And we're working with several banks to solve this problem because we are the only infrastructure system that actually can manage, monitor, and know exactly who you are through your web of trust. And then we're going to eliminate double entry because we're going to take this dumb data that the whole world has right now, because for some reason they think my birthday changes every time I walk into an office, and turn it into smart data. Elimination of double entry saves millions and millions of dollars. And then you're going to automate all your processes. So we launched our beta test in June of 2016 on what we called then a private chain, now called a side chain, because we knew the system wasn't going to work the way the industry said it was going to work, and we have some proof on that. We have launched with 59 workflows. We've had over 250,000 patients run through our system. We started with over 4,000 physicians on our network. 400,000 smart workflow contracts have gone through our network, and we have saved 2.4 million hours and $40 million in administration costs just during our beta test in 18 months. That's not even 18 months. That was in 12 months period of time. There's over 10 billion workflows just in the United States alone. We can't build it. You guys can. The community can. You don't have to be a developer. You have to have a passion. You have to become a subject matter expert in something. And the way our system works is it's going to be built and used by the community. We've proven that it's successful. We know it is for a fact. And we're going to continue to focus on things that are important to me personally, because that's what's important to my family, my life. Trust me, I like you all, but my life is a little more important to me than maybe yours. Yours is second to me. Or your kids. Once you have moved the system from a reactive healthcare system, you can start moving to a proactive healthcare system. We're actually launching this in Chicago. We have over 16,000 physicians on the network that we're going to be rolling this out with. There's going to be a day when you are sitting there and all of a sudden you get a message on your phone or your TV, because we built that too. Not the TV, but the technology that's in it. That says, hey, Brett, let me tell you another story. Just a few weeks ago, about a month, maybe 8 weeks ago, I guess, my mom calls me and she goes, hey, Brett, I just want to let you know I'm okay. I'm in the hospital. Everything's okay. I'm like, what happened? I think I was speaking in, I don't remember where I was. I speak all over. So what happened? She goes, well, I fainted at home. Luckily, my aunt was there. They called the ambulance and they rushed me to the hospital. My oxygen levels dropped to 84. 78 or so, 76, you're going to probably die. I'm like, all right. She goes, yeah, I got an infection in my lungs. I'm like, okay. So she was in the hospital for 7 days. And I'm sitting there thinking, dang it, I got to get this built faster, because if she was wearing a wearable, which exists, to monitor her oxygen, when it dropped to 96 or 97, like, hello, there's something wrong with your body. Could you imagine when the moment that happened, it popped up on your phone, and your doctor's like, hey, I just want to let you know, your information's wrong. We think you're sick. What are you feeling? Well, I'm feeling a little fatigued. Okay, we're actually going to, you need some antibiotics. We're going to have the antibiotics delivered straight to your home. It's there. It's ready to use. The infrastructure systems are there. Nobody is using it because they're not willing to work together, because they don't want to build it on somebody else's system. So my question is, how will you own your cure? Maybe it's save time and save money. Maybe it's securing of your healthcare records. Maybe you just want an Amazon review. Wouldn't that be nice? If 55,000 people said that guy was the best, and 1,000 said he was, in his life or death, dude, I'm probably going to go with the community. Screw what my payer says. That's what I would have done if it was there when my dad was sick. Maybe it's to reduce compliance, errors, fraud, and abuse. Actually use that information for good. Connect to one, connect to all with a friction-free, transparent healthcare solution. And that is what we're helping the community build. We're giving it to the world. I'm Brett Blackman, CEO and co-founder. My CTO and co-founder is absolutely one of the most brilliant people in the world. This isn't our first time building the fastest, because we already own this and patented it, the fastest distributed autonomous organization in the world through data processing and security protocols. You're all touching our technology right now of one of our sister companies. It runs every telecommunications and security network in the world. It's the fastest processing system in the world. I can't tell you who our customers are. You can probably guess. Most of them sit on the Fortune 50. We wanted to take that technology we've been using in that space and move it to healthcare to save lives. There's no time. Oop. Let's see here. I don't know why it's not playing all of a sudden. Anyway, our data system is absolutely already operational. We're validating our information through our distributed networks via blockchain to validate the information, to validate the workflows, to validate that your birthday hasn't changed. It's a very simple solution, actually, if you actually think about it. It just takes time, and we have the infrastructure and the engineers to actually build it. There it goes. I don't know if that goes back up on the screen or not. Really cool video. Once we've done this, we absolutely will transform the way healthcare is done and the way distributed autonomous organizations worldwide are done. We've already proven it. We're actually launching a SAFT round. I've actually put my partner and I put a little over $6.5 million into this project so far. We have done zero outside raising of capital at all. I'm not that way. I am absolutely going to put my money where my mouth is and try to focus on solving the world's problems. I have the biggest why ever. I will not fail. I don't have time to fail. We're launching 6.5 billion. So we're doing contributions in USD, BTC, LTC, BCH, and ETH. And here is our roadmap. You can go to splashtoken.io to see more, but we are absolutely in the process of changing the world. And my question is, will you join me? Thank you very much.
Great job, Brett. Awesome. Well done.
Sorry, dude. I didn't have time.
The timer. I saw that. Yeah. You did great. That's good. All right, so make sure you go chat with Brett in between a break here. In the meantime,